My name is Kimmel Bombard. I am a BSN student at the University of Southern New Hampshire. We are going to be filming a physical exam for my class. It'll be viewed by my instructor, possibly other faculty. In a normal doctor's office physical exam, you'd put on a Johnny, but we're going to do all of the exam through your clothing. Are you okay with that? And if you have any questions, stop me at any time. Okay? Start by washing my hands. All right. I'm going to inspect your hair and head now. First I'm going to look. And feel. Any tenderness?
No.
You can put your hair back on. All right. Can you smile? Can you raise your eyebrows? Can you frown? Can you close your eyes tight? Can you open them back up? Can you pop out your cheeks? Great. All right, now I'm going to look at your eyes. I'm going to start by inspecting them. And then we're going to do a few eye exam tests. The first one would normally be the Snellen test, which is a chart that's on the wall, and you read it at different lines, and it has the letters. You've seen them in the doctor's office. If you were at line 20 and you were able to read it, that would mean you had 20/20 vision, and that would mean that you can see what others see at 20 feet. But I don't have one, so I'm going to have you read the newspaper. All right, can I have you hold it at about 14 inches and cover one eye and read me a line?
Questions persist months after rollout.
Good. Other eye.
Former Maryland governor still testing the waters.
Great. Now we're going to test your peripheral vision. And what I want you to do is look at me and cover one eye. You start with your right eye and tell me when you can see my pen light in your peripheral vision.
Now. 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 Now.
Great. Cover the other eye. Tell me when you see the pen.
Now. 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 Now.
Okay, readjust your eyes. Okay, I'd like you to follow the pen with your, hold your head still and follow the pen light with your eyes. Good. Move this pen. All right, I'd like you to look at the pen, then look over my shoulder. Look at the pen again, and then over my shoulder. Now I'm going to look at your corneal light reflex by shining the light on your nose. You can look straight at me. Yeah. Great. Now I'm going to test your pupil reaction. The light's going to come across, so look it straight at me. Good. Do you have any pain? I'm going to touch your face, okay? Also inspecting the skin around your face and your nose and all that. I'm going to palpate your arteries here. Okay. Can I have you open your jaw? Move it side to side. Put it out. Okay, I'd like you to clench your teeth, and I'm going to provide resistance. Don't want me pulled out. Wonderful. I'm going to check your nose now for symmetry. Any pain? Can I have you do cover one nostril and breathe in and out? Cover the other nostril and breathe in and out. Okay, I'm good. I'm going to check your sinuses now. Any pain there?
No.
Here?
No.
Okay, now I'm going to look at your ears. I'm going to start by inspecting them. going to feel. Any tenderness?
No.
Okay. I would like you to cover your other ear, and I'm going to whisper, and I'd like you to tell me what you hear.
22 crew,
I'm going to do it with the other ear.
14 baseball.
Great. Now, can I have you open your mouth for me? Hold your tongue right where it is. Yeah? Now I would like you to lift your tongue up, side to side. Okay? Close your teeth so I can see your gums. Wonderful. Can you say ah? Stick your tongue out and say ah. Thank you. And now I would normally do a gag reflex with a tongue depressor, but I don't have one, so I'm not going to do that. Plus I save you. I'm going to feel your lymph nodes now. Any tenderness? That's good. We just felt your neck. I'm also going to look at it for symmetry and look at the skin on it. Looks good. I am going to feel your, palpate your carotid arteries now. Okay. I'm going to go run back. Feel your thyroid. Right. Feels a little weird. Okay, so can you swallow for me? One more time. Great. Now I'm going to feel your back. Inspect it and feel your back. Any pain?
No.
Feeling the muscles of your back. Okay, I'm going to percuss your back. You're going to feel some pressure. Any tenderness or pain?
No.
Okay. Now I'm going to listen to your lung sounds. As I listen to your lung sounds, I'd like you to take a deep breath in and out. I'll tell you when. Okay. In. Out. Deep breath. Deep breath. Deep breath. Deep breath. Deep breath. Great. All right, I'm going to come around and I'm going to look at your chest. Any tenderness?
No.
Inspect it. I'm going to listen to your lung sounds on the front as well, so I will need you to take deep breaths again. Okay? Deep breath in. In. And out. Deep breath in. Deep breath. Deep breath. Deep breath. And again. One more. And again. Okay. I'd like you to lean forward and take a breath in and hold it for a second. And breathe out. Great. So now we're going to have you lay back. All right. I'm going to look at your chest here. And now I'm going to listen to your heart sounds. And it's going to seem like it's taken a while, but I'm listening at each different noise the heart makes. And then I get to go back and do it with the bell of it as well. Okay? Okay, I'm going to do it again. Now I'm going to listen for your apical pulse. I'm going to use the clock on the wall here. Great. Now can I have you lean towards me? Awesome. Bring your arm over. Great, great. All right. I'm going to start by my next section is going to be inspecting your abdomen. Great. Next, I'm going to listen to your stomach. I'm going to start listening to your bowel sounds. Okay. And I'll listen to your arteries. Okay. Now I'm going to percuss. My hand's going to tap on your belly. I'd like you to tell me, I'm going to feel your belly, tell me if there's any tenderness. Nope. Great. So now we're going to do some range of motion for your hip. So I would like you to bring your left leg straight up, bring it down. Can you bring it back up and move it in, over, out, great, down. Bring your right leg all the way up, bring it down, bring it back up, bring it out, bring it in, and bring it over. Great. Then I would like you to bring your knee to your chest.
Which one?
Your left leg, bring your left knee to your chest. Turn it in, up, in, out, in, okay, all the way. Great, you can put it back down. Do your right leg now, in, out, bring it in, and over. Great, you can put that down. Now I'm going to inspect your legs. I'm going to look at the skin, get the symmetry of them. Now I'm going to feel them for temperature. Did I tell you I was also inspecting the skin on your legs as well? Any tenderness anywhere? No. And then you feel the pulses behind your knees. You bend your knee just a little. Okay. You can put that down. Now I'm going to inspect your feet and look at those. I'm going to feel your pulses. Okay, I'd like you to have you bring your nose to your toes, down to the floor, back up, out, in, circle. And then I'd like you to scrunch your toes, spread them out. I'm going to look at your toes in between. You can just relax. I'm going to do a test now. That's called the Babinski test. Try not to just keep your feet neutral, okay? It might tickle. Okay, try not to let it tickle you. Great. Now I'm going to do a test where I want you to close your eyes and I want you to tell me on your body when you feel it and where. And use left or right, okay? So go ahead and close your eyes.
My forehead, my right arm, my left hand, my left knee, my right foot.
Great. All right, you can sit up again. All right, I'm going to have you move your head. I'd like you to move it up, down, shoulder to shoulder, side to side. Shrug your shoulders. Okay, now we're going to do all that again with resistance. So up, down, shoulder. No, shoulder. No. Put your shoulders down. Push your head to your shoulder. Yeah. Yeah, the shoulder. Okay, now your shoulders. Great. Now I'm going to inspect your upper extremities. I'm going to start by looking at your arms, your hands. Okay, I'm going to feel them. Looking at your skin, looking at the symmetry. All right. I'm going to feel your pulses. Good. I'm going to feel the lymph node in your arm. Just relax. And this one. All right. Can you put your hands out for me? Okay, so we are going to do some range of motion, some movement now. So I'd like you to bring your arms up, palms out, bring them up and over and down behind your neck. Okay, good. Bring them back down. Bring them forward, up, then bring them down behind your back, then up and behind your back. Great. Then if I can have you put them out in front of you, turn them over, turn them back, hands up, hands down, make a fist, spread your fingers, up, in. Great. Well, I have your hands here. Go ahead and just relax this hand. I'm going to have you close your eye and tell me what position your finger is in, up or down.
Up, up, down,
Great. Excellent.
up, down, down.
Great. I'm going to have you now, let's touch your thumb to the base of your pinky. Can you do it? Great. Now I would like you to touch each finger with your thumb as quickly as you can. Quick. Now I'm going to have you put your hands up like this, and I don't want you to let me to push or pull them. So I'm gonna push and pull. Good, you can put them down. Relax your legs. I'm going to push and pull them also, so don't let me push or pull. Okay. I'd like you to relax. I'm going to touch your deep tendon reflex here in your knee. And on this one. Good. Now I'm going to put an object in your hand after you close your eyes, and I want you to tell me what it is. So close your eyes.
A pencil.
And the other hand?
A Q-tip.
Yes. All right. And now I'm going to have you stand, and I'd like you to walk normally and then turn around. And then I'd like you to walk heel to toe. A little bit further. And stop and turn around and walk back on your toes. You can stop and turn around and walk back on your heels. Great. Okay. Then come right over here, stand here. And, all right, come out a little bit. All right, I'd like you to just relax, close your eyes, and stand there for a minute. This is called the Romberg test. Good. Wonderful. While you're standing there, I'd like you to bend forward and touch your toes. Great. Come on back up. All right. I'd like you to twist. Twist. Okay. Side to side. Then I'd like you to bring your knee up and and bend your other knee. Great. Put that foot down. Toe down. Great. We are done. Thank you.